Yes, definite pay rise is important as well, but it's more important for the patient safety. Think about the young families. They have to still pay the bills, they have to pay the house rent, they have to travel, and they have to feed their family. If they don't have enough money on the table, then they can't come to work. And that's the reason loads of people, they're struggling. They are leaving this profession, and we are struggling on the floor because there's a shortage of staff. Intensive care is struggling, A&E department is struggling because we not have a staffing. And look at the patient waiting time, 18 minutes to 18 hours. That's ridiculous. Patients, they have to wait for 10 hours in the corridor, and that's not safe. And that's we are standing here in the cold weather for our patients. Yes, we need a pay rise, but more important for our patients.
It's about the fact that ordinary people, everybody needs a good health service, that's equally available, paid for from taxation and owned by the public. So we've been campaigning for all those things for 10 years. But we're not alone. There are Save Our NHS routes in most of the towns and cities across the country. There's a big movement. But we're against privatisation of the National Health Service. We don't want all the resources of the NHS sucking into the private sector. So we've been campaigning against that. But we also think the NHS needs to be properly funded, because without proper funding, without proper pay for these nurses, then staff shortages, which are already 150,000 vacancies across the country, unless they're properly paid, vacancies will only get worse. And if staff vacancies get worse, then also patient care will get worse. So we're supporting the nurses today to be properly paid, to make sure that staff come into they see it as a good area to work, so they'll come into it in the future, and that will guarantee proper patient care for everybody.
Well, a lot of people are supporting you. Do you find that is the case?
Yeah, I think the nurses here today, they've had massive support from the public, and also not just like passers-by, but people have been visiting here, like us and other people, just to say that we do support the nurses up to the hilt.
We're against cuts in the NHS. We're against privatisation. We find that privatisation is creeping. Actually, it's not even creeping now, but it's moving quite fast and taking over big parts of the NHS. So a lot of the NHS budget is going to pay private companies to provide services that the NHS could provide themselves. And then, because they're private companies, that money goes to pay their shareholders rather than go back into the NHS. So it becomes a profit-making organisation instead of a non-profit making organisation, and it's not serving the people like the people who work for it, and serving the people who use it. It's serving the shareholders, and that is completely wrong.